us with an explanation of the severity of this virus? Is it something that you could be hospitalized for? Are people dying? Can you just talk about that real quick, please?
Sure. So in the majority of cases, the virus can be fairly mild, it doesn't create morbidity and mortality issues like other viruses, but it can be serious in certain circumstances. It can leave permanent damages to that particular patient. So it is definitely something that needs to be seriously taken. So especially when it's on top of maybe some other medical conditions, but just like any communicable disease, it's something that needs to be taken seriously.
Do we have an idea of what the death rate might be, or are we not seeing many deaths with this virus?
As of yesterday, I believe when I looked at the cases in United States, there have been no deaths associated with monkeypox, but that is something that we'll have to continue. I'm not really sure at the global level what are some of those numbers, but as of right now in the United States, no deaths have been reported.
Okay. Thank you, Dr. Vann. That's all, Mr. Chairman.
Murphy.
Thank you. Dr. Vann, is there presently a recommendation for who should be seeking the vaccine?
Yeah, so we are looking for individuals that are considered high risk. So communities of men who have sex with men, that have multiple partners, that are HIV infected, that are in receiving PrEP, which is the medication for HIV prevention, as well as people that have had contact with individuals that may be infected with monkeypox, or they're confirmed cases with monkeypox. So we know that this criteria can be very fluid, just like we've learned from past experiences. It may change depending on what that community transmission is going to look like, what the cases are going to look like, and if it's identified in other communities that we need to focus on.